Fitness and physical activity are strong predictors of risk of illness, so being physically active on a regular basis is extremely important for your health. Adults that are physically fit and are physically active have a lower risk of early death compared to adults who are inactive. Physical inactivity is one of the top modifiable risk factors for many diseases, such as cardiovascular disease, diabetes mellitus, metabolic syndrome, colon cancer, breast cancer, obesity, hypertension, osteoporosis, osteoarthritis, and depression. It can help control body weight, strengthen bone and muscles, improve mental health and mood, improve the ability to do daily activities, and increase the chances of living longer. To lower your risk of cardiovascular disease, get at least 2 hours and 30 minutes a week of moderate intensity aerobic activity, and doing that can put you at lower risk for heart disease and stroke. You can reduce your risk even further with more physical activity. Regular physical activity can also lower your blood pressure and improve your cholesterol levels. Regular physical activity can reduce your risk of developing type 2 diabetes. If you have type 2 diabetes already, physical activity can help control your blood glucose levels. Being physically active lowers your risk for colon and breast cancer. Research shows that physically active people have a lower risk of colon cancer than do people who are not active, and physically active women have a lower risk of breast cancer than do people who are not active. For cancer survivors, research shows that getting regular physical activity not only improves your physical fitness, but also helps give you a better quality of life. Regular physical activity can help keep your thinking, learning, and judgment skills sharp as you age. It can also reduce your risk of depression and may help you sleep better. Research has shown that doing aerobic or a mix of aerobic and muscle strengthening activities 3 to 5 times a week for 30 to 60 minutes can give you these mental health benefits. Some scientific evidence has also shown that even lower levels of physical activity can be beneficial. Both men and women who reported increased levels of physical activity and fitness were found to have reductions in relative risk of death by about 20 to 35%, proving that an increase in physical fitness will reduce the risk of premature death and a decrease in physical fitness will increase the risk. People who are physically active for about 7 hours a week have a 40% lower risk of dying early than those who are active for less than 30 minutes a week. Vigorous activity is not required to reduce the risk of premature death. By doing at least 2 hours and 30 minutes a week of moderate exercise, you can put yourself at a lower risk of dying early. Any small improvements in physical fitness are associated with a significant reduction in risk and are beneficial to the body in multiple ways.